we're gonna have a great time. We're gonna talk about what I want to share with you guys are the only 3 strategies that you really need to feel successful and get prepared for the exam, for the CHT exam. And what we're going to do is we're going to be creating a 3-month roadmap of what it's going to look like from now until then. I don't know if you guys are studying, but I used to study, and I used to sit there and read for 2 hours and then look back and be like, oh my God, what did I read? I don't even know what I read, dear Lord. And then you just feel like this cycle of like wasted time, or you're reading stuff and you have these questions and you don't have anyone to really ask. I mean, there's a couple of groups here and there, or there's one person here and there, but really sometimes it's like hard to really get the time from them, right? Like you can ask them, but then you feel kind of bad about asking and taking so much of their time. Or you can ask, but they're maybe not able to explain it to you in a way that you understand. Somebody told me, what was it? Like she was studying for the exam and she had a mentor that she had calls with once a week, and she would more or less share what she did as a clinician. And at the end of the day, when you're studying for the exam and you want to get the best and you choose the best answer on the test, it doesn't matter what treatment technique you use. It's really about the book, like how you critically think through a certain type of problem, how you solve that problem, how you make a decision about what needs to happen next. What are your recommendations? What are you going to do? That kind of stuff. So when you study for the CHT, it really does help you to sound more confident, right? So I've got several people in the program who started out, didn't have a job in the setting they wanted, and they're like piecing the jobs together and trying to get as many hand hours, upper extremity hours as possible. And they've got the hours, they've got the years, but they just weren't getting the positions that they needed. But coming into this program and studying like the way you're meant to study, which is not just by memorizing, but by really truly understanding and problem solving, it made him more confident. We also fixed his resume up a little bit. And then he was more confident with the studying. And before he even took the exam, he would go in there and say, like, I know X, Y, and Z. I'm sitting for the exam. And sure enough, he got the job. He got the job where he needed to get the job. And then he continued to study, and then he passed. Boom, done. And it didn't matter that he had spent, he had taken it before and wasn't successful, but he took it this time and he was. So I think that everyone here on this call, anyone who's listening, anyone who is gonna listen back to this, I think it's totally possible for you to prepare and feel successful in your preparation, sit for the exam and be successful, right? So we're gonna go into some of those strategies. So everyone who is on this call who is already in the program know how I work, but if you don't know how I work, please grab a paper and pencil. I write everything on the board, and I want you guys to write and create this roadmap with me, okay? Because it's, the program really isn't just about, oh, you enroll into the program and miraculously you pass. You've got to put in a certain amount of effort, and I hope that some of you guys who've been studying and you've been dabbling a little bit, now we're gonna get really serious, all right? So we're gonna dive into the 3 strategies that you need in order to prepare to feel successful to sit for the exam in May, right? And then after that, we're going to create a 3-month roadmap. All right, 3-month roadmap. I'm going to show you exactly how I break down the next 3 months. Perfect? You guys ready? Tonight, I did pour a little bit of wine in here. I hope, cheers. All right, so when we're talking about the only 3 strategies that you guys need to know, I encourage a lot of writing because it's really important to remember and kind of list out anything you write. It's going to help you remember, right? So here are the frameworks, right? This is the framework. So when it comes to preparing and sitting for the exam. I break up the exam into two frameworks. One is a mindset, right? And the other one is knowledge. Okay, so when it comes to mindset, if you kind of think about it, it's kind of like the mental aspect. It's the emotional side of things, right? This is the part where you might feel overwhelmed, which then can lead into anxiety. And test anxiety is a real thing that we have to really address and deal with, right? Anxiety, fear, what else? Failures, past failures, sometimes even past successes can lead us and get us stuck from a mindset perspective because we've been successful our whole lives and everyone tells you the story, the scary story of the CHT being such a terrible test and there's a 50% pass rate, but 50% people fail, and 50% people pass. So how do you make it successful for you, right? But all of this leads to also confidence, right? So there's a lot that we can do in terms of this, but we're not going to focus on this, but I really wanted to bring it up tonight because I think in terms of frameworks and getting yourself ready to take the CHT, that this is a really important component. But this is a component where with my current students, we address privately. We get on the private calls, the private coaching calls and stuff like that. And right now in the program, when you enroll now, you get 3 private coaching calls, right? Tonight, we're gonna focus on the only 3 strategies you need to focus on when it comes to knowledge. And this is where everyone focuses on, right? This is where our focus is because this is like more tangible. We need to know the arm, we need to know the hand, the wrist, the elbow, the shoulder, the nerves. And this is all like that book knowledge stuff. And so a lot of times you can tend to get overwhelmed with the amount of information you know. And now I always say this, and it's true, but when you study to understand something, not only will it help you to feel more confident when you go take the exam, right? Because you never know the kind of questions that they're going to give. But it's going to help you become a better clinician because you're going to be able to critically think no matter what the case. So if you get a script, if you don't get a script, if you get a script and you don't understand, you get the script late, it doesn't really matter, right? I have a clinic and we're a private out-of-network type of clinic. So we tend to get patients that come in without a prescription. Right? And sometimes, we get patients like workers' comp patients or something, and they come in, nobody has a script, and you got to dissect everything because of the incisions that they have. Based on where the incisions, you can almost spot like what type of injury they had. Based on the story, you can spot, what was the cascade of events that may have happened, right? And so that allows you, studying for this allows you to become that critical thinker or problem solver and decision maker. So you can feel confident going to, like if you work with a doctor really closely, like I work with several surgeons closely. I'm sure some of you guys who work in a doctor's office, have the opportunity to talk to them. And those surgeons, I promise you, rely on their CHTs, rely on their hand therapists to tell them what's up. To tell them, hey, I know that this is, I have a guy, ulnar nerve guy that I guys, if you guys are in the program, I showed you guys. And so he went to the doctor's office and we've been talking to the patient himself about possible surgery, but he's been like, no, I don't want surgery. Well, he finally went to the doctor and the doctor was like, I think it's ready for surgery. So now I'm going to email the doctor and I'm going to tell him like, listen, I would love to know what surgery you're contemplating, because I've seen this before and I know if they only do a capsulectomy at the PIP and they don't do one at the MP, we're not going to get the results that we need to get for him. So I'm going to put my 2 cents in there in terms of what I would love to see, like if I had a say. There's a way of saying it so they really buy into why you're saying what you're saying. But I've seen this before, I've worked with this before, and I know based on this and this, if we, are you considering, that's how I do it. Are you considering are you considering not only a PIP capsulectomy, but also an MP capsulectomy? Because man, those MPs have no give. And then you kind of, and then, I just want to clarify so that I could better explain to the patient, and we can talk about the therapy process after. Because, I know this is an aggressive recommendation, but usually when people especially like him, smoker, stiff, came in late, I need scripts, authorizations, blah, 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 before he even gets into surgery. So we are all set and there is no delay in his start, right? If I want to get the best possible results out of your second surgery surgeon, Dr. So-and-so, who is so wonderful and great, I've got to get this guy started in a certain way, in a certain manner, so that, not only does he do well, but you look good too, right? So that's really important. And then I also can say, well, this guy really needs, what I've seen work is after a capsulectomy or after a tenolysis, therapy daily works, for a month. So that's just my take. That's not necessarily in the test. But the test doesn't say that necessarily. The test is, the questions are going to be like, if this guy had an ulnar nerve laceration, was that an ulnar nerve, is a low nerve laceration or a high nerve laceration, and which nerves would be affected, blah, blah, blah. And if that was the nerve affected, what kind of deformity are you can see, and what kind of splint would you make for that patient, right? So that's where the problem solving skills, and that's where everyone's going to focus their time in terms of studying. So what are the 3 top strategies? Well, one of them, you've got to schedule out your time. You've got to study out your study time. I tell you, whatever is not written will not get done. We're going to do the 3 months out, and then you're going to go on your own. You're going to break that down into weeks, right? What does your week look like? Start on a Monday or start on a Sunday, wherever your week wants to start, map it out and what it should look like, because you want to be realistic. Remember when I talked about mindset? You want to be realistic, because if you're not realistic with yourself, you're going to set these really unrealistic goals, and then you're not going to meet them. And then when you're not going to meet them, you're going to shit on yourself. You're going to be like, oh, you suck, you're not studying, you can't get anything done, you're never going to be ready. And that's not a good place to be. When you're studying, you've got to do things that make you feel good, because when you feel good, you will do good, you will do more of the good stuff. So when I say schedule out your time, be really realistic, be really honest with yourself. So one of my examples I always say is okay, so on Sunday, I like to do brunch maybe, right? But a Brucey brunch, I'm not realistically going to study after that. If it's unlimited mimosas, I'm not sure I'm going to retain any information, right? So the best thing to do is, if I know that on Sunday I've got plans with friends and I don't want to over sacrifice, right? My time. And it's a really important brunch, right? So if I set it at a certain time, then if I know I am useless after that, I need to make sure I study before. And then because I study before, I can reward myself with going to brunch. That's going to be my reward, right? So every day you're going to do something where you set yourself up. Do you study well in the morning, right? So are you an AM person? Do you need to set yourself up to study before work? Are you an afternoon person, right? So are you coming home from work and that kind of stuff and studying? Are you a lunchtime person who can study for 30 minutes or an hour during lunch or between patients? Not everyone has the capacity to do that, but some people do. And if you have time, and you have to know yourself, first of all. Nobody's gonna know how you study more than you. I don't know how you study. I mean, we can get on a coaching call, we can talk about it and stuff like that, but really at the end of the day, you know how you study. So I've got some people in this program who know that they need a long time, so they're in it now already, and they're going to take it in November, just because they know they're going to need it for that long, right? I was kind of one of those people. When I studied, it took me kind of like, I would say a year, but really, honestly, was it really a year? Because I just dabbled for the first couple of months. Like, I would study in bed, so I'd start reading The Rehab of the Hand. Next thing you know, I'm like, you know, pass out. Should I really count those months where I was just dabbling? Well, I don't know, but when I got really focused, I really honed in for a good 6 months. But I knew the kind of person that I am when it comes to studying. I needed to read things, I needed to write things, I need to review it again, right? I'm a kinesthetic learner, so a lot of the videos or the way I teach, I draw on myself, I draw on other people, I get you to touch yourself as a different way of remembering. Some people know that they're an auditory learner or a visual learner. So in the program, we draw on people, we draw on boards, we write things out, but you'll know what kind of learner you are, and you're going to schedule yourself out a specific way. Another strategy that can make it very effective for you in terms of studying is time blocking. So this is a strategy that I teach my own staff, not just the members in the programs, but my own staff. If you're gonna work on something, you know, chunk out your time. Just like I chunk out my information, I chunk out my time. So when you plan your study time, you will also plan what you are going to be studying, right? So let's say, for example, in that morning, you really only have 30 minutes, or let's say you have 45 minutes, right? You want to time block it and say, okay, I'm gonna study here. And then in the afternoon, you're gonna say, well, I have more time here. I'm gonna do 2 hours, right? And every day you should be trying to do that. If you're trying to do stuff in between other things, like, oh, let me study, but then I'm gonna do this other thing over here, you're never gonna get anywhere. You've really got to chunk your time up. I mean, a lot of times I would say a 2-hour maximum, and then you're gonna need to give yourself a certain break, and then you can chunk up some more. So for example, a lot of people work, right? So they're gonna use their weekends to get the majority of their work done. Or they work 4 days long and they get 3 days. So for example, like Michelle gets Fridays off. So really, her Fridays should be broken up into, well, let's pretend I gotta take my kids in. So from 9 to 9:10, 11 is a 2-hour block, right? 2-hour block. And then she could do a 30-minute break. Now, I'm not saying that inside the 2 hour, there are no breaks. There are breaks. I'm gonna talk about that in a minute. And then we're gonna do another 2 hour, right? And then that's how she can break up her day. So it's 2 hours break, 2 hours, and then maybe she take an hour or two break and then come back to it so that she can maximize out her day, right? Be realistic with your time, right? Be realistic with your time. So that she can get the maximum that she can. Because if you're working long days, like for example, my Tuesdays and Thursdays, if I was studying for the CHT right now, it'd be shot, right? Because I work from very early until very late, Tuesdays and Thursdays most days. But then my Monday, Wednesdays, and Fridays are a little bit easier. So you have the opportunity to change it based on, but time blocking is really huge, right? And so much about preparing, the strategies to really prepare, it's really about being effective and efficient with your time. We don't have time to waste. If you are studying for the May exam, you don't have time to waste. If you are studying for the November exam, you don't have time to waste either, because that shit is gonna come real fast. So you don't want to waste it. You're not in a rush, but you want to be effective with your time, right? So that you won't feel the stress, you won't feel the overwhelm of like reading something and not being able to really remember it, right? Or spending hours and hours on something, but you don't even know anything at the end of the day, right? I don't want you to feel that way. Like, it sucks to feel that way. So the last strategy, right, is actually, it's how to use your time effectively. Effective use of your time. So in the last strategy, there's actually two components to it, right? The two components to it, the two strategies, is a time method. It's a time strategy. And the second part of it is a topic strategy, right? So to be really effective with the time that you're studying, one of the things that I talk about here is when you're sitting down to read, right? When you're sitting down to read, start your timer, start a stopwatch. And then as soon as your brain starts to wander off into space, like you're reading something on like how tendons heal and the hyaluronic acid and this and the sheath of that and like all this crazy stuff, and you're like, what? And your mind starts thinking about dinner. What are you gonna make tonight? Okay, stop your stopwatch and look at how long of a time lapse that was. That's how long your attention span is, right? That's how long your attention span is. We actually have very short attention spans. Like our brains just like, whew. So it takes a lot of work, actually. It takes a lot of work to like hone that in. It is just practice, right? So what you want to do is you want to start a timer, start, and then stop, right? And then the thing is, how much time elapsed, right? How much time elapsed? So let's say it was 15 minutes. So you know, like you can kind of almost grade yourself. Do that a couple of times and you'll see where your concentration is, right? You'll see where your time, your attention span lies. So what you're trying to do is you're trying to build that attention span so that you can be more effective. You just be more efficient, right? So if it's 15 minutes, you gotta say, okay, my attention span is 15 minutes, right? You know, and then do something where it's just 15 minutes, cut yourself off, get up, do some stretch for like literally not even a minute, and come back to it. Start the thing. And over time, you should be able to 15 to 20, 30 to 45. As you become more and more successful in your studying, you're gonna see that you have more time, right? Now, another way of being more effective and efficient is topic strategy. So if you take a look and you're reading a book, right? So Rehab of the Hand is my book that I really teach out of. I teach out of Rehab of the Hand because a lot of it is explained. The key thing about studying from Rehab of the Hand is that not everything is important. Just because they wrote it down doesn't mean you need to know it. You don't need to know everything. You need to know the most important thing as a certified hand therapist, right? As a certified hand therapist, what is it that you need to know to be the most effective therapist for your patient? Outside of being effective for your patients, what are the answers you need to pick on the test so that you can pass, okay? So topic strategy, if you look at the Rehab of the Hand, at the beginning of the chapter, it always tells you like the main points, right? Look at those main points and then flip through the chapter a little bit, because let's be honest, some chapters are easy and some chapters are hard. I mean, like, just to sit there and talk about the extensor tendon mechanism, like I got through 4 pages and that chapter is like the book. It's like 10 pages later, but I only, like the one video that I did in the program, it's like 50 minutes long. Oh no, it was a TFCC. I don't know. you can like let me know which one, if you guys are in the program, which video was. It was like I think I literally said, okay, this is chapter 38 and we're going to talk about the TFCC, and I went for 52 minutes or something, and I only covered like 3 pages. Because some topics are really grand and big and some topics are small. So your other way of being really effective is putting a start timer in your brain and a stop timer in your brain. So I'm going to read, so if you flip through that chapter, there's subheadings. So I'm going to read from here to this subheading, and then I'm going to just make sure that I understood that topic. I took notes on it. So you're going to read that, take your notes, flashcard, whatever it is that you think is important. And then when you stop yourself there, you look at your notes again. You read your notes, whether you read it quietly to yourself or read it out loud because you're an auditory person. Do it, right? Take an inventory of where you're at before you go on, so that you're not just sitting there and flipping, and at the end of the chapter you're like, I really don't understand what I did. So break up your topic into smaller topics, right? And that's how you can be more effective with your studying. So if you can be more effective with your studying, and then you time block the time and you actually scheduled it out, right? These are really honestly the 3 only strategies that you need to implement, right? Implement in order to feel prepared, feel successful in preparing to sit for that exam.